If you're a woman over 50, you're not alone if you've experienced embarrassing moments related to bladder control or unwanted odors. This is one of those topics many women whisper about but rarely discuss openly. Yet it affects millions of us. Today, we're going to have an honest, compassionate conversation about 7 common mistakes that can contribute to urinary odor and incontinence issues. More importantly, we'll discuss practical, doctor-recommended solutions that can help you regain confidence and comfort in your daily life. I want to be clear from the start. Experiencing these issues doesn't mean you're getting old or that there's nothing you can do about it. Many of these problems have straightforward solutions, and speaking with healthcare providers about these concerns is always encouraged. Let's dive into the 7 mistakes that doctors see most often, and how you can address them starting today. Mistake number 1. Inadequate hydration habits. The mistake. Many women think that drinking less water will reduce bathroom trips and potential accidents. This seems logical, but it's actually counterproductive. Why it backfires? When you don't drink enough water, your urine becomes concentrated. Concentrated urine has a stronger, more pungent odor and can actually irritate your bladder, making urgency and frequency worse, not better. Think of it this way. If you had a dirty cup and only used a tiny bit of water to rinse it, would it get clean? Of course not. Your bladder works similarly. It needs adequate fluid to flush out bacteria and waste properly. The medical explanation. Concentrated urine contains higher levels of waste products like urea and ammonia. These compounds create that strong, unpleasant smell we want to avoid. Additionally, concentrated urine can irritate the bladder lining, leading to increased urgency and sometimes urge incontinence. The solution: aim for 6 to 8 glasses of water throughout the day, but spread them out. Don't drink large amounts all at once. Try having a glass when you wake up, 1 with each meal, and sip consistently between meals. Stop drinking fluids about 2 to 3 hours before bedtime to minimize nighttime bathroom trips. If you're concerned about bathroom access during outings, map out restroom locations ahead of time rather than restricting your fluid intake. Pro tip: if your urine is pale yellow or clear, you're well hydrated. Dark yellow or amber-colored urine usually indicates you need more fluids. Mistake number 2. Poor bathroom hygiene practices. The mistake: using harsh soaps, douches, or feminine hygiene sprays in an attempt to eliminate odors, or not cleaning properly after bathroom visits. Why it's problematic. The vaginal and urethral areas have a delicate pH balance. Harsh products can disrupt this balance, leading to infections, irritation, and actually worsening odor problems. On the flip side, inadequate cleaning can allow bacteria to multiply. The science. Your vaginal area naturally maintains an acidic pH of around 3.8 to 4.5. This acidic environment prevents harmful bacteria from taking over. When you use alkaline soaps or douches, you disrupt this protective barrier. The right approach: use only warm water or a very mild, unscented soap to clean the external genital area. Always wipe from front to back after using the bathroom to prevent bacteria from the anal area from reaching the urethra. Change underwear daily, and choose breathable cotton fabrics over synthetic materials. After urinating, gently pat dry rather than wiping vigorously, which can cause irritation. What to avoid: douches, feminine deodorant sprays, scented tampons or pads, and any product that promises to make you smell fresher. These often contain chemicals that can cause more harm than good. When to see a doctor. If you notice a sudden change in odor, burning during urination, or unusual discharge, these could be signs of an infection that needs medical treatment. Mistake number 3. Ignoring pelvic floor weakness. The mistake: accepting bladder leaks as an inevitable part of aging without taking steps to strengthen the pelvic floor muscles. Understanding the problem. Your pelvic floor is like a hammock of muscles that supports your bladder, uterus, and bowel. Childbirth, hormonal changes during menopause, aging, and even chronic coughing can weaken these muscles. When these muscles are weak, they can't properly support your bladder or help control urine flow. This leads to stress incontinence, leaking when you cough, sneeze, laugh, or exercise. The impact. Even small amounts of leaked urine can create odor problems, especially if it's happening regularly throughout the day. The ammonia in urine can cling to clothing and skin, creating a persistent smell that regular bathing might not eliminate. The solution: Kegel exercises. Kegel exercises can significantly strengthen your pelvic floor muscles. Here's how to do them correctly. First, identify the right muscles. The next time you urinate, try to stop the flow midstream. Those are your pelvic floor muscles. However, don't regularly stop urination as an exercise. This is just to help you identify the muscles. To perform Kegels, contract these muscles for 3 seconds, then relax for 3 seconds. Work up to holding the contraction for 10 seconds, then relaxing for 10 seconds. Aim for 3 sets of 10 repetitions daily. You can do Kegels anywhere, while watching TV, sitting at your desk, or waiting in line at the store. No one will know you're exercising. Beyond Kegels, consider seeing a pelvic floor physical therapist. These specialists can teach you proper technique and may recommend additional exercises or treatments. Some women benefit from biofeedback or electrical stimulation therapy. Realistic timeline. You may start noticing improvements in 6 to 8 weeks, but it can take 3 to 6 months to see significant changes. Consistency is key. These exercises need to become a daily habit. Mistake number 4. Dietary choices that irritate the bladder. The mistake: consuming foods and drinks that irritate the bladder without realizing the connection to urgency, frequency, and odor issues. Common bladder irritants. Caffeine is the biggest culprit. Coffee, tea, chocolate, and some sodas can make your bladder more active and increase urgency. Alcohol is another major irritant that can also dehydrate you. Acidic foods like citrus fruits, tomatoes, and spicy foods can irritate some women's bladders. Artificial sweeteners, particularly those found in diet sodas and sugar-free gum, are also common triggers. How they affect you. These irritants can make your bladder more sensitive, leading to increased urgency and frequency. When you're rushing to the bathroom more often, you're more likely to have accidents. Additionally, some of these substances can actually make urine smell stronger. The elimination diet approach. Try removing suspected irritants from your diet for 2 to 3 weeks, then gradually reintroduce them one at a time. Keep a bladder diary noting what you eat and drink alongside your bathroom habits and any accidents. Bladder-friendly alternatives. Instead of coffee, try herbal teas like chamomile or ginger. Replace citrus fruits with berries or melons. Choose water over sodas, and if you need sweeteners, honey or small amounts of regular sugar are usually better tolerated than artificial alternatives. The reality check. You don't necessarily have to give up your morning coffee forever. Many women find they can tolerate small amounts of irritants, especially when consumed with food or earlier in the day. It's about finding your personal threshold. Timing matters. If you do consume bladder irritants, have them earlier in the day and always with food. Avoid them within 3 to 4 hours of bedtime to minimize nighttime bathroom trips. Mistake number 5. Wearing the wrong undergarments and clothing. The mistake: choosing clothing and undergarments based solely on appearance rather than considering their impact on urinary health and odor control. Synthetic fabric problems. Polyester, nylon, and other synthetic underwear fabrics don't breathe well. They trap moisture and heat, creating an ideal environment for bacteria to multiply. This can lead to infections and stronger odors. Tight-fitting pants, especially synthetic leggings or shapewear, can put pressure on your bladder and make urgency worse. They also contribute to moisture retention in the genital area. The cotton solution. Cotton underwear allows air circulation and absorbs moisture. It's the gold standard for urinary and vaginal health. If you must wear synthetic clothing, make sure at least your underwear is cotton. Fit matters. Choose underwear that fits properly. Not too tight, not too loose. Seamless styles can be more comfortable and reduce irritation. Change underwear daily, and consider changing twice daily if you're experiencing frequent small leaks. Protective products. If you're dealing with light incontinence, use products specifically designed for urine absorption, not menstrual pads. Incontinence pads are designed to handle the different pH and consistency of urine, and typically offer better odor control. Change these products frequently. Don't try to get maximum wear out of them. Fresh protection every few hours is better for odor control and skin health. Clothing strategies. Choose darker colors and patterns that won't show small accidents as easily. Keep a change of underwear in your purse or car. Consider wearing a light cardigan or jacket that can be tied around your waist if needed for coverage. Mistake number 6. Delaying bathroom visits. The mistake: holding urine for extended periods, either out of convenience or because bathroom access is limited. Why this causes problems. When you regularly hold urine beyond when your body signals it's time to go, several issues can develop. First, your bladder can become overstretched, which weakens the muscle over time. Holding urine also allows bacteria more time to multiply in the bladder, potentially leading to urinary tract infections. UTIs often cause strong, unpleasant-smelling urine along with other uncomfortable symptoms. The overflow effect. When your bladder gets too full, you're more likely to have urgency that's difficult to control. This can lead to rushing to the bathroom and potentially having accidents along the way. Developing better habits. Try to urinate every 3 to 4 hours during the day, even if you don't feel a strong urge. This helps keep your bladder from becoming overly full and maintains better muscle tone. Pay attention to your body's early signals. Don't wait until you're desperate. When you first notice the urge, start planning your bathroom visit rather than trying to postpone it. Practical solutions. If your job or lifestyle makes regular bathroom breaks difficult, talk to your supervisor about accommodations. Most employers understand that bathroom needs are a basic human requirement. Plan ahead when you'll be in situations with limited bathroom access. Use the restroom before leaving home, even if you don't feel a strong urge. The scheduling approach. Some women benefit from timed voiding, going to the bathroom on a schedule rather than waiting for the urge. Start with every 2 hours and gradually extend the time as your bladder retrains itself. Mistake number 7. Not addressing underlying medical conditions. The mistake: assuming that urinary issues and odors are just a normal part of aging that you have to accept, rather than investigating potential underlying causes. Hormonal changes. Menopause brings decreased estrogen levels, which can thin the tissues of the urethra and vagina. This can lead to increased susceptibility to infections and changes in normal flora that affect odor. Hormone replacement therapy or topical estrogen treatments can sometimes help with these issues. This is definitely something to discuss with your healthcare provider. Diabetes connection. Uncontrolled diabetes can cause frequent urination and can make urine smell sweet or fruity. If you're experiencing increased thirst, frequent urination, and fatigue, blood sugar testing is important. High blood sugar also increases the risk of urinary tract infections, which can cause strong-smelling urine and other uncomfortable symptoms. Urinary tract infections. UTIs become more common as we age due to changes in the immune system and urogenital anatomy. Symptoms include burning during urination, frequent urination, cloudy or strong-smelling urine, and pelvic pain. Don't try to tough out a UTI. They need antibiotic treatment and won't resolve on their own. Untreated UTIs can lead to more serious kidney infections. Other medical causes. Certain medications can affect bladder function or urine odor. Blood pressure medications, diuretics, and some antidepressants can impact urinary function. Neurological conditions, previous surgeries, or structural problems can also contribute to incontinence issues. When to see a doctor. Make an appointment if you experience sudden changes in urination patterns, blood in urine, severe pelvic pain, or if home remedies aren't helping after 4 to 6 weeks of consistent effort. Don't be embarrassed to discuss these issues. Healthcare providers deal with urinary concerns regularly. It's a common part of women's health, especially as we age. What to expect? Your doctor may recommend urine tests, blood work, or imaging studies. They might refer you to a urologist or urogynecologist who specializes in these issues. There are many treatment options available, from medications to minimally invasive procedures. Let's quickly review the 7 mistakes we've covered. Poor hydration habits. Inadequate bathroom hygiene. Ignoring pelvic floor weakness. Consuming bladder irritants. Wearing the wrong clothing. Delaying bathroom visits. not addressing underlying medical conditions. Your action plan. Start with 1 or 2 changes rather than trying to overhaul everything at once. Perhaps begin with improving your hydration and starting a daily Kegel routine. These 2 changes alone can make a significant difference for many women. Keep a simple diary for a week or 2, noting your fluid intake, bathroom visits, any accidents, and what you ate or drank. This information can help you identify your personal triggers and track your progress. The important message: these issues are common, treatable, and nothing to be ashamed of. You don't have to suffer in silence or accept them as an inevitable part of aging. With the right approach, most women can see significant improvement in their symptoms. Remember, every woman's body is different. What works for your friend might not work exactly the same way for you, and that's okay. Be patient with yourself as you try different strategies and find what works best for your lifestyle and body. Final encouragement. Taking control of these issues can dramatically improve your quality of life, confidence, and comfort. You deserve to feel comfortable in your own body, and with these tools and strategies, you can work toward that goal. If you found this information helpful, consider sharing it with other women in your life who might benefit. Together, we can break the silence around these common health concerns and help each other live more comfortably and confidently.